Deja, thanks. 6:30 this morning. Breaking news just in our newsroom in the last half hour. Johnson & Johnson says they submitted data to the FDA for emergency use authorization of a booster shot of their COVID-19 vaccine. This is for people ages 18 and up.
And this news comes as scientists divided over the need for boosters when so many people in the U.S. and other countries are still unvaccinated altogether. So this morning, Dr. Hawkinson joins us live to talk about this. Doctor, this news coming out this morning, what's your first reaction to boosters for J&J?
I first think that it's internal data, and I think it's good about why they're submitting. We need to really kind of wait and see what the ACIP committee looks at, recommends, the FDA looks at, recommends. I think overall we are just trying to get as much protection for people as we can, and we'll continue to do that. What is the best way moving forward? We've heard Dr. Fauci say, and we've surmise sometimes maybe will 3 doses of an mRNA vaccine be fully vaccinated? Will 2 doses of Johnson & Johnson mean you're fully vaccinated? It's hard to tell, but all that is in the context of we still know that whatever vaccine you got still provides great protection against hospitalization, severe disease, and death, even 6 or more months out. So we know that the vaccines and the immunity they induce continue to work really well to keep you out of the hospital.
Doctor, the other big news that we've been watching the last 24 hours is that COVID-19 cases are trending down nationally in a big way and in the Kansas City region. So let's look at this graph that shows the decline that started around the beginning of August. That August peak we've been talking about for a long time, and then that steady decline. Doctor, cases across the country doing this too. How big of a deal is this? It feels like a big deal when you see some headlines that say COVID-19 in retreat.
But we also don't want to be lulled into
a false sense of security, right? So break this down for us.
Yeah, I think it goes back to hoping for the best and being prepared for worst. Certainly that trend looks good. We've heard about these 2-month cycles that the surges seem to take, and that is the infections followed by hospitalizations and followed by deaths. So first we see the cases. We always knew for this surge that the cases weren't the best bellwether because maybe some people weren't getting tested, maybe they were doing home tests that don't really get reported. But really, what are we looking at in hospitalizations? And we can see that hospitalizations are going down as well. So I think that's good. I think that is because, number one, the infections have run through those populations that were in those high-risk situations. But we know even people that weren't in those high-risk situations were getting it. We also know that vaccination was growing as well. And so I think the combination of that really helped reduce this surge now. But in addition, we know that there is that large population that is still ineligible for vaccination, and that is those younger children. So hopefully, when and if those young children are able to get vaccine, we can get them vaccinated, and we are moving into these colder months now where people are going to really have to be inside to do things. Hopefully, that will then help aid in keeping cases down when and if there is another surge. Because we have the holidays coming up, and we know that people are going to do what they want to do. They're going to travel. They're going to spend time with friends and family for the holidays. So it's important that even if you've had the infection and you survived, you really need to get the vaccine. And if you are in that recommended group for getting a booster or additional doses of vaccine, you should get that vaccine dose.
Can we talk about that when and if next surge? Because in a couple of months, if we continued that couple-month cycle, that is a holiday season for so many people.
Because it felt so bad when we had to put masks back on just recently. Like, I thought we were past this. We don't want that again. Right?
And I think people are getting fatigued with that, but we want to be safe.
Yes.
So with the addition of hopefully kids being able to be vaccinated, with more people being exposed and people who are already vaccinated, have we reached a point to where a surge would look different and be less severe?
Yeah.
I hope so. So from what we've seen from the virus itself, we've seen many different variants of concern. First there was that initial D614G variant that came out, April of 2020 that really took over the globe. Then we saw Alpha, and Alpha really seemed to take over. But now what we've seen really globally is that Delta has really, in any environment it has gotten into, has outcompeted other viral variants. So right now we are really only dealing with Delta variant. Now, could other variants arise that take over that? They certainly could. We have to be aware and anticipate that. But from what we've seen compared to other variants, Delta so far is outcompeting and more fit than the other variants. So I think from that case, we're dealing right now with Delta. And then as we get further into it, it's going to be all about behavior. And so the best part of the behavior that we can do is get vaccinated. And we have to figure out how to get more people who are unwilling to get vaccinated, because you and I know that people are still going to be gathering, going indoors, doing things that are really in those high-risk situations. But that being said, we know that our economy needs to continue to roll on. We know that people need to continue to have jobs, be able to work. And so what is the safest way to do that? And we really have to figure that out and take that step by step. If it includes masking when you go into a restaurant and eating, then we have to do that. We have to continue to do those things that create those safe environments so that we don't see all of the cases and hospitalizations and death that we have in the past few waves as well. I think we anticipate other waves, but we don't really know what that will look like. However, we should say that if everybody who is eligible gets vaccinated, that wave will certainly be, I believe, a lot less than it has been.
Quickly, before we let you go, Dr. Hawkinson, I asked you this same question yesterday morning on the morning media update. I want to ask you to talk about it a little bit more. How much more difficult the message is when people see the numbers dropping, people who are not vaccinated, for them to go, well, okay, I don't need to go get a vaccine if the numbers are dropping. Does it make that message all the more difficult when numbers drop? Even though that's a good thing that numbers are dropping, does it make the sell more difficult?
Yeah. Oh, it absolutely does. I have a patient in my clinic on Friday who is immunosuppressed. Has bad lung disease, still refuses to get the vaccine. So it absolutely does. I don't know how much more information somebody needs now in this time and how long we have been going through the pandemic just to understand, number one, that these vaccines are safe and very efficacious. And the issue is, anytime you get this virus now, you really are rolling the dice for the complications. We don't know. Some people have done well with reinfection, but some people have done a lot worse. And so the best way to protect against that, to protect against any new variants that may arise, is to get vaccinated. And so it is really hard to tell, to continue to give that message, trying to talk with people and ask them what their exact concerns are. But just as you said, there may be other reasons why people don't want to get it. They may not want to get it because they do see cases going down and think they've gotten through the wave and been okay, or gotten through the surge. So it's very difficult, but I think we still need to continue to address those issues head on and really continue to endorse the benefits and the extremely low risks of the vaccines to really get everybody vaccinated, because every single person that gets vaccinated is going to be one step closer to keeping everybody in our community protected and keep everything running and getting back to more normal as we did in 2019 as compared to 2020.
Sure. Dr. Hawkinson, as always, we appreciate your time. Thank you very, very much.